Keep away from football. You can get injured doing that, you know.
You want to go dancing? Are you sure? You might hurt your knees.
Should you still be running? At your age, you might have a heart attack.
Imagine if we spoke about sport the same way we spoke about sex.
Focusing on all the negatives without acknowledging the positives.
Sexual well-being is an approach that recognises the importance of sex and sexuality for our happiness and health. It means feeling respected, safe, and supported.
It means feeling worthy of enjoying your own sexuality and having the agency to decide how you enjoy it. Better sexual well-being means better health, less shame, and more respect.
If your work involves supporting the health and well-being of others, then this matters to you.
What is sexual well-being? It's not just about sex.
It's feeling comfortable, thinking about, talking about, or enjoying sex. Not feeling anxious, ashamed, or embarrassed.
It's feeling safe, not feeling powerless or at risk of sexual harassment, sexual violence, or coercion.
It's feeling respected as a sexual person and being respectful to others in all your relationships, not being marginalised or discriminated against.
It's having good self-esteem, valuing yourself, and feeling worthy of enjoying your own sexuality without feeling out of control or harming others.
It's agency, being able to decide whether you have sex or not, who with, and how, so it's always consensual.
It's feeling supported, having someone supportive to talk to who won't judge you, and having access to the information and services you need.
Sexual well-being matters to everyone, any age, any gender, any sexual orientation, any background.
Whether they're having sex in person
or online.
Whether they're having sex by themselves.
With partners.
Or both.
Or neither. It's feeling comfortable, even if you're not sexually active.
And sexual well-being doesn't happen in a vacuum. It's intimately bound up with your relationships and power dynamics. It's shaped by your upbringing, by your culture, and sometimes unrealistic expectations from porn.
We all have a right to sexual well-being. And as professionals, we have a responsibility to support the sexual well-being of the people we work with.
Taking this approach in your work might feel awkward at first, but there are benefits. Talking about sexual well-being can open up new conversations, help the people you support feel understood, and even improve your own well-being.
What does a sexual well-being approach look like in practice? The good news is that you already have all the skills you need. You use them every day. It doesn't have to be embarrassing or feel forced.
By focusing on comfort, safety, respect, self-esteem, agency, and support, you can open up the conversations you have with people naturally.
For example, a teacher reflecting on his own level of sexual comfort can find new ways to navigate difficult topics in class.
A nurse at a breast cancer clinic can speak to a patient about sexual self-esteem after a mastectomy.
A youth worker can use the idea of sexual agency to help a girl find the right way to let her new partner know she's not okay with being choked.
A police officer can use the concept of sexual respect to help a man understand the impact of catcalling.
A residential care worker can ask their elderly client about sexual safety to help them talk about harassment or coercion.
A social worker speaking to a young person in care can bring up sexual support and help them find trusted information.
And when all professionals in Scotland bring a sexual wellbeing approach to our day-to-day work, we can improve Scotland's wellbeing together.